Good evening. Today, the COVID Cabinet Committee has approved a number of measures that constitute a careful and prudent plan to remove Alberta's public health restrictions and move on from a widespread pandemic response to get our lives back to normal. Before sharing this plan with you, I'd like to address some of the considerations that informed our decision today. First, it is clear that we passed the peak of Omicron infections about 3 weeks ago and are now seeing the result as COVID-related hospital admissions are declining. This is good news and broadly reflects the experience of other jurisdictions around the world when it comes to the Omicron variant. That's why countries like England, Scotland, Ireland, Denmark, Sweden, Norway, South Africa, Finland, and many others have lifted all or almost all public health restrictions in recent weeks. It's also why a growing number of states across the United States have also announced the lifting of most public health measures, including mask mandates, such as the states of California, Connecticut, Delaware, and New Jersey just in recent days. I note that the provinces of Saskatchewan and Quebec have followed suit with their own announcements earlier today. Alberta's active cases and rolling 7-day average of new cases has dropped steadily across the province from about 7,000 a day to approximately 2,000 a day, with total active cases falling from 55,000 to about 30,000 now. The positivity rate, that's the percentage of PCR tests that come back positive, has also continued to decline. And leading measures like wastewater surveillance has shown a general decrease in most regions of the province. And as I said, we see new COVID hospital admissions coming down, another important leading indicator. It's also important to note that because Omicron is more transmissible than previous variants of COVID, it is infecting more hospital patients who don't actually have severe COVID symptoms. So about 40% of patients in the hospitals who have tested positive for COVID are not actually being treated for COVID. They are what we call incidental cases. Now, they can add some additional pressure to the system, but to put this in context, with about 1,500 overall non-ICU COVID patients, actually only about 900 of them are being treated for COVID or COVID as a secondary condition. It has also and always been the government's approach to keep public health measures in place only so long as they are absolutely necessary to protect public health and our healthcare system. Throughout the pandemic, Alberta's policy response has always sought to avoid overwhelming our health system while minimizing the damaging impact of restrictions on the broader health of our society. Earlier in the pandemic, when vaccine uptake was much lower, other treatments weren't available and testing was much harder to come by, so more drastic government interventions were necessary to keep people safe. And let me just pause to address what happened in Alberta during the Delta wave in August and September. The reality is that we simply didn't have high enough vaccine rates, nor did our neighbors in Saskatchewan. That's why we were hit harder. But all of that has changed. Now, 9 out of 10 Albertans over the age of 12 have some level of vaccine protection. Antiviral drug treatments to prevent severe disease and hospitalizations are now available, and more will come on stream throughout the year ahead. In other words, with what we know now about the virus and the tools we have to fight it, the threat of COVID-19 to public health is no longer outweighs the hugely damaging impact of health restrictions on our society, on people's mental health, on their emotional well-being, on our broader social health. So now is the time to begin learning to live with COVID. These restrictions have led to terrible division, even amongst families and friends, and inflamed sometimes tensions in our communities and neighborhoods. They've disrupted and even destroyed so many livelihoods. We will never know, we'll never be able to do a full accounting of the extent of the pain and hardship that restrictions have caused. But we do know some things. We know we have seen in Alberta and across the developed world a significant increase in mental and emotional health challenges amongst children and adolescents, for example. We have seen an increase in domestic violence. We have seen the failure of many businesses, and of course, at the beginning of the pandemic, record high unemployment. And at a time when the world should be wide open and full of possibility and hopefulness, COVID and the restrictions associated with it have robbed thousands of young children with the simple joys of just being a kid. I was speaking to a young father the other day who told me that his 10-year-old daughter had spent 20% of her life under COVID health restrictions. We cannot remain at a heightened state of emergency forever. We have to begin to heal. And so Alberta will move on, but we'll do so carefully. We'll do so prudently. We will do so only if it does not threaten the capacity of our healthcare system. So our plan will involve 3 steps, starting with easing restrictions on activities and situations that have been shown to be lower risk throughout the pandemic. The first starts with children and youth. Step 1 will remove almost all restrictions affecting children, including removing the mask mandate for all K-12 students effective this weekend. Outside of the school setting, kids 12 and under will now be exempt from the general mask mandate that will continue to apply in indoor settings for approximately 3 weeks to come. As I have long said, kids have been subjected to a heavy and I think unfair burden throughout the pandemic. And it is given the very low threat that COVID-19 poses to the health of children, it is no longer justifiable after 2 long years to continue to disrupt and restrict the normal lives of kids. It is time to let kids be kids. And I am determined to ensure that should we ever have to come back to any kind of measures in the future, God forbid, that we will not affect the wellness, the freedom, and the normal lives of kids. Step 1 will also end the restriction exemption program in its entirety, effective midnight tonight. I wanted to say this about the restriction exemption program. We brought this in September when our healthcare capacity was under very severe stress, particularly in intensive care. And at the time, we saw that 90% of our new ICU admissions were amongst unvaccinated people, and the province was generally under-vaccinated relative to the rest of Canada. We simply had to do something urgent to prevent a catastrophe in intensive care and in our hospitals generally. And we had to do something to get our vaccine rates up. And so we chose a measure that avoided shutting down businesses and places of worship, but allowed us to reduce transmission while also seeing a significant increase in vaccinations. We went from about 75% vaccination rate to now 90% on first dose, and we went from 68% to 87% second dose coverage. That has made a huge difference. It has saved many lives. And at the same time, we have seen a change in transmissibility. The reality is that with the high level of infectiousness of the Omicron variant, plus the waning protection from infection of a second dose, most Albertans got their second dose 8, 9, or 10 months ago, we have seen that that vaccinated individuals are still at a high risk of Omicron of infection, not of severe outcomes, not of severe disease, but of infection. And so the point is simply this, that the restriction exemption program has served its useful purpose. It's done its job. It is no longer leading to higher vaccination rates. In fact, we have seen our vaccination rates effectively frozen since early December. And so our approach to COVID must change as the disease changes. And I believe that's exactly why the Chief Medical Officer for Canada, Dr. Tam, recommended earlier this week that provinces re-examine programs like their proof of vaccination programs. That's exactly what we're doing with this decision. Finally, step one will remove capacity limits for all except large capacity venues of over 500 people. Minister Copping will provide further details on these measures. Now, following these phase one measures, we will take 3 weeks to carefully monitor trends with a focus on hospitalizations. If and only if we continue to see a downward trend in hospitalizations, we will then proceed to phase two. Our current target date for phase two is March the 1st, at which point we plan to lift most remaining restrictions, including the indoor mask mandate, the requirement to work from home, and remaining capacity limits. Following this stage, we will take more time to monitor trends, again with a focus on whether pressure on our hospital system is manageable. When it is safe to do so, we would then proceed to stage three, which would be to eliminate all remaining public health measures at that point. So let me add an important caveat. If the current trends reverse themselves and if we see a significant and sustained increase in pressure on our hospitals, we may have to pause some of these measures. But we are determined to get our life back to normal, doing so in a way that ensures that a hospital bed is there for everyone who needs one. And that is why a big part of the upcoming provincial budget later this month will be about increasing the capacity of Alberta's healthcare system. Because despite the sometimes heroic efforts of our fantastic frontline healthcare professionals over the past 2 tough years, the same 2 years have spotlighted serious shortcomings in the Canadian healthcare system, which we simply must address, beginning with the federal government paying for its share of an increasingly costly and complex modern healthcare system with an aging population. So I very much hope that today's long-awaited optimism this announcement rather gives a sense of optimism and hope to Albertans. I know that some will say this is too much change and that we are moving too fast. But please keep in mind that we have the benefit of a few weeks being behind a few weeks of other jurisdictions, such as the United Kingdom, and we can watch what happens as they return to a regular way of life. For example, in Britain, most restrictions have been dropped as the Omicron wave has subsided, and aside from masking in high-risk settings such as acute care and mandatory isolation for people with COVID, there are no other countrywide mandates in Britain. Cases and hospitalizations for COVID are continuing to drop there, and in all the other countries I mentioned that have lifted measures with the exception of Denmark. While we are closely monitoring what other places are doing, and have no doubt, please do have no doubt, that our plan is focused on the data here in Alberta. It ensures that we will remain sure-footed, ever aware of what is happening in our own healthcare system, and maintaining protections for those most at risk until the very end of this plan for getting back to normal. So we are moving carefully, we are moving with confidence. While we are working towards an end to restrictive measures and the damage that they impose, I want to be clear. None of this is an end to COVID-19. New variants will arrive, and we will still see times when cases are higher in the province. We will likely also see times when there is additional pressure on the hospitals. But restrictions, mandates, and those kinds of interventions will not and must not become a permanent feature of our lives. With widespread uptake of the vaccines, as I say, close to 87% fully vaccinated with 2 doses, and nearly 1.5 million Albertans with having received their 3rd shot, we are well positioned to live with this virus as we do with many other infectious diseases. The vaccines are doing what we've always said they would do, to protect us from severe illness and outcomes. The numbers don't lie. Over the past 3 months, the rate of COVID-19 deaths of healthy but unvaccinated individuals in Alberta is over 7 times more than those who have been fully vaccinated. When this previously healthy but unvaccinated group is compared to those who have been fully vaccinated and boosted with their 3rd shot, the comparison widens. the rate of unvaccinated deaths is approximately 17 times that of people who have been fully vaccinated and received a third shot. We have been strongly encouraging Albertans to get vaccinated because we know it works, and we want to keep you and those around you safe. So now that the overwhelming majority of Albertans are protected, we are confident that we can begin to ease restrictions while preventing undue strain on our healthcare system. And we are not returning to normal all at once. So please continue to exercise good judgment and make smart decisions, decisions that make sense for you and your family. Our acute care system is still under real stress, and we may still see waves of COVID-19 come and go, as I've said, in the months ahead. But we will always need to protect the most vulnerable and may need to adjust as we start this transition. The virus has certainly left all of us bruised, but we are not broken. We Albertans are never broken. We are always resilient. It is time to call on that resilience as we move in the path to recovery.